England's lockdown will continue at least until the 8th of March. Boris Johnson said today that schools will not reopen before then, the earliest moment that the most vulnerable could all be protected by the vaccine. Other lockdown restrictions might be eased after that. Northern Ireland's lockdown already runs until March. Wales and Scotland will review their plans in the next few days. But for travellers arriving anywhere in the UK, stricter measures are coming, with passengers arriving from certain countries to be required to quarantine for 10 days in a hotel. Our political editor, Gary Gibbon, reports.
The Prime Minister has confirmed the third lockdown will stretch to the 8th of March at the earliest. Any phased opening of schools won't start until then. Other lockdown easing will take longer.
How did it get to this,
Boris Johnson told MPs there just wasn't enough data about the impact of the vaccine on COVID for any earlier relaxation.
If we achieve our target of vaccinating everyone in the four most vulnerable groups with their first dose by the 15th of February, and every passing day sees more progress towards that goal, then those groups that have developed immunity from the virus about 3 weeks later, that is by the 8th of March. We hope it will therefore be safe to begin the reopening of schools from Monday the 8th of March, with other economic and social restrictions being removed thereafter as and when the data permits. Then or thereafter, I should say, Mr. Speaker.
Tory lockdown critics were reassured by the promise that vaccine rollout would, if it works well, feed into lockdown relaxation. But for now, the government had a new lockdown measure to add to the pile: compulsory quarantine if you're returning from certain listed countries.
In order to reduce the risk posed by UK nationals and residents returning home from these countries, I can announce that we will require all such arrivals who cannot be refused entry to isolate in government-provided accommodation, such as hotels, for 10 days without exception. They will be met at the airport and transported directly into quarantine.
Nationals from these 30 countries are already banned from visiting the UK as they're seen as COVID hotspots. What's changed is that UK citizens trying to return from these countries will now face 10 days secured in a government-designated hotel room with a 4-figure bill to pay for the stay. That daunted some UK residents arriving from Brazil at Heathrow today.
I think they are doing the checks they're supposed to do. You do a COVID test before you leave Brazil. You do another one over here. And then, after 10 days, you have to do another one again.
For sure, it would stop a lot of people from traveling and being around.
Today, the rule doesn't apply for us, so this is fine. But if we had to stay in a hotel, that would be a problem with money.
The government also says you'll need to fill out a permission to travel form if you're leaving the country. You won't be allowed out if your reason isn't covered by exemptions. Scotland's First Minister said the quarantine rules should apply to all countries.
We will be seeking urgently to persuade them to go much further.
Nicola Sturgeon also said Boris Johnson's planned visit to Scotland tomorrow broke the spirit of the lockdown rules.
And I would say me travelling from Edinburgh to Aberdeen to visit a vaccination centre right now is not essential. And Boris Johnson travelling from London to wherever in Scotland he's going to do the same is not essential.
The Labour leader, Keir Starmer, said the government should use the February half-term break to vaccinate school teachers and move other frontline public sector workers up the vaccine queue as well. The Prime Minister said the government would not be doing that and would stick with the existing age and condition-based priority list for vaccinations.
So this is what the latest government figures covering the last 24 hours show. A further 1,725 people have sadly died, bringing the official UK total to 101,887. There have been over 25,000 new cases, and over 311,000 people received their first dose of the vaccine yesterday, meaning more than 7.1 million people have now received their first jab. But in Europe, no such progress on vaccinations, and an ongoing row between the EU and the pharmaceutical company AstraZeneca got even more vitriolic today. Our health and social care editor Victoria MacDonald joins me from the newsroom. Victoria,
This is an increasingly unseemly row between the European Union and AstraZeneca, the drug company behind the Oxford vaccine. This has been going back and forth for the past few days, escalating today, though, because there was a row over whether AstraZeneca was going to turn up for a meeting. Now, let's leave that bit parked because the meeting did happen. What is it all about? It boils down to contracts. The Commission wants vaccine doses produced in the UK plant diverted to Europe because they have been warned of a massive shortfall by the company. They say, the European Commission, they ploughed billions into the development and manufacture of the vaccine and are entitled to their share. But AstraZeneca said Britain was there first, signing a deal back in June, 3 months before the EU, and therefore the UK requirements come first. Well, this was the EU response to that.
Not being able to ensure manufacturing capacity is against the letter and the spirit of our agreement. We reject the logic of first come, first served. That may work at the neighbourhood butchers, but not in contracts, and not in our advance purchase agreements.
Sharp words indeed. So what's behind this? Of course, everyone is desperate for the vaccine, and the UK has done particularly well compared with most other countries in having secured deals and supplies, and the EU is facing a great deal of criticism for being slow off the mark to both authorise the vaccines and roll them out.
Thanks, Victoria. Well, earlier I spoke to Richard Horton, the editor of the medical journal The Lancet. In his latest book called The COVID-19 Catastrophe, he argues that the UK has lacked a clear and bold strategy to fight the pandemic. I asked him how much blame he laid at the government's door for the high death toll.
Well, I'm afraid I would lay a very large proportion of the blame at the government's door. The fact is that we didn't learn the lessons from the very first lockdown. We should have pursued a policy of zero COVID, and we didn't. We created a test, trace and isolate system that was essentially outsourced to the private sector. We had a communication plan which was confusing, which was erratic, which lacked any kind of consistent leadership. We lost the trust of the public last summer, and the government struggled to regain that trust ever since, all the way through the past 12 months. The government decisions have been too slow, too indecisive. They didn't follow the science.
If we take, for example, the two announcements today, schools, Boris Johnson hopes they'll be open beginning of March, and also he's clamped down on borders, but not as much as some had wanted. Is that going to get us to zero COVID?
Well, first of all, it's a real mistake to set any date out. You raise expectations, and consistently, I'm afraid, the government has overpromised on dates and underdelivered. I wouldn't focus on any date. What we need to do is we need to have a series of stages where we have the most extreme lockdown for some weeks, which will bring the very high rates of transmission at the moment down to a matter of a small number of cases per day per 100,000. And that will then allow us to begin to open up society a little bit.
How many cases per day before you can start to open up, in your view?
If we get down to less than 20 cases per day for 5 days per 100,000 people, this is what Melbourne did. At that 20 case threshold, they are able to have outdoor gatherings of fewer than 10 people, indoor gatherings of 5 people or less. Primary schools were then able to open.
And with the borders policy, I mean, it is a pretty tough crackdown in order to protect the vaccine rollout, effectively, to protect it from being destroyed by mutations coming in. Not tough enough in your view?
Well, I'm very glad we have got border protections. It's taken too long to get to this point. I would be very worried that already we will have the other two variants, the South African and the Brazilian variant, which could well be in the country already. It might be too late. But that said, it's good we've got some border protections. I think, though, that in this first phase, when you're trying to get down from the heavy community transmission we've got currently to just a few cases per day, we should have locked our borders completely.
You say in your book that you fear that it will take 2 to 3 years to get to what you call some kind of equilibrium. Do you think we're going to have intermittent lockdowns until then? if we don't pursue the zero COVID strategy that you're talking about?
That's right. The past 12 months will become the new normal. And the reason why it will take 2 to 3 years is because the challenge isn't the United Kingdom or Europe, it's the world. The unit of measure for success here is the whole planet. And until we're able to vaccinate the planet, the populations of the world, then we're not going to get this pandemic under control.
Richard Horton, thanks very much.
Thank you very much indeed.